All right, well, welcome everyone to the first Media Monday of this bizarre fall 2020 semester. I want to thank everybody, first of all, for joining us. And with us this evening is Dr. Mimi Perreault, and many of you know she's an assistant professor in the Department of Media Communication and an expert in crisis response reporting. And she's going to be talking about national, state, and regional COVID-19 reporting resources, and we'll reserve plenty of time toward the end for whatever questions you might have. So I'm going to turn it over to Dr. Perreault. Thank you for joining us.
Hello, everyone. Welcome, and I'm so glad to see so many of you. And many of you are students attending, and many of you are just interested in getting more information about reporting on COVID-19. But some of the things I want to talk about can be used to just get information and report in general. So, you know, even though we're living in the pandemic era, as they call it, right? The pandemic condition. You know, a lot of us are a little bit COVID-19'd out, but it seems like for some reason it relates to everything that's going on right now, right? So like, is the university gonna, do sports or not? Are we going to be able to go back to having regular classes? And, are kids going to be able to go back to school? And what is the economy going to look like? And what is our current presidential candidates? What do they say about our president and our presidential candidate? What do they say about COVID-19? And what do governors say? And what do local representatives say? And what is our city doing, right? And what kind of regulations have we put on businesses in the area? And so I think for a lot of people, just kind of breaking all that down is really challenging. One of the things we know about local reporting, and I mentioned this in my Media Monday when I was talking about covering crisis and disaster, right at the beginning of the pandemic, we were talking about this in Media Monday. And one of the things I was telling people is that, often people do not consult local news sources. So they really don't know what's going on in their backyard. And a lot of times there is not a lot of context for what it is that they're dealing with, in this case on a local scale compared to what the national outcome is, right? So, we are all talking about COVID-19 in April. It was about New York City and Seattle and Los Angeles, right? Because that's where the big breakouts were in the United States. But now it's, those breakouts or those surges of cases are all over the country and not actually in those larger cities. They're in more rural areas, kind of like where we are here in Appalachia. So, thinking about it when we're covering it and covering it at a local level, there are some things nationally that are extremely relevant to us. But at the same time, there are a lot of things that we don't necessarily need to give the national picture on because honestly, like, proximity is a really big news value. So not having proximity to whatever you're facing in your local community could become a problem. So I'm going to kind of go over some different tips for covering this stuff that have been determined to be best practices, and then also give you guys some really good resources. So if anybody wants, I actually put a link to a document in the chat. So you're welcome to keep that downloaded on your computer, for your own records if you want it, or you can just use it a reference and go click on it. It's in my 365 drive. So, right now, and I'm just going to kind of walk through some of the things that are there. And so one of the things I want to start with is kind of a story. And I'm going to share my screen so I can do this. But one of my favorite sources for the pandemic has actually been this organization called, can you see my screen, Dawn? No? Well, what is it doing here? I said share screen. Okay, share screen. There we go. Has been this organization called Stat News. Is anybody familiar with Stat News? Yeah, no. So Stat News, their main goal is to kind of take numbers and information that has to do with numbers and make it more relevant to people. And one of the things we know about reporting and reporting with numbers and data is that people don't necessarily understand numbers. I mean, I basically hear from every journalism student or media and communication student, like, I hate math. I don't want to have to do math. But the truth is, math is super important because it represents a story, right? So if we have statistical information, that represents a specific interaction between different things that are going on. So for example, with COVID-19, the percent infection rate, right? That's super important for us to know and understand, because if we understand that like 2% of everybody at ETSU has COVID-19, and don't quote me on that because I'm not giving you actual numbers here, but that is pretty serious deal, right? Because that means 2% of the population, you know, I don't know how many students are at ETSU, but you take 2% of that population, say it's, you know, 1,800 students total, right? And we're talking 2%. That's still a pretty big number of people that could have this disease at one point. And so it's important to understand what those things mean. So I actually subscribe to Stat News. They also have training for journalists through this website where you can actually learn how to report these numbers better and pay a small rate. They have free lectures that they give. Also, so if you join their mailing list, they'll do like a, you know, a brown bag talk on, you know, covering different things. But they've been covering COVID, but they also cover lots of other science issues that deal with data. So it's a really great site. But the thing that really came to my knowledge was today, this article on the front here about a pastor in Baltimore. And one of the things that I thought was really interesting is that it told the story of a person who's interacting with the virus and trying to stop the virus's spread at a church, who has a lot of trust in the information and how he's relaying that information to his congregation. And to me, this was a really great story. It was thinking about COVID's impacts on a national level, but also illustrating how that's applicable locally. And, you know, it didn't run in a local news organization's, on a local news organization's site. It ran on Stat News, which is this webpage. And it, you know, it's got pretty good art, but it's a really great story. It talks about, it connects basically these numbers and this data concerning COVID-19 outbreaks, and specifically what it's like to live in Baltimore and deal with some of that stuff. And some of the numbers in Baltimore are pretty insane, to, you know, what is actually going on nationally and the numbers that Stat News has been sharing. And so they have, throughout this article, I'm just going to show you guys, they have several different links to resources that are also on their website, but also things, information and data that comes from outside their website. And they have, you know, a little bit more information throughout this about kind of different things that are involved, right? So the unique part about the issues with COVID-19 and Baltimore is that this pastor is also the pastor at a Black church and Liberty Grace Church of God. And he also is dealing with issues concerning, you know, racial violence, which have really been in the news recently because of Black Lives Matter and the violence against, you know, people like Freddie Gray and others in that community. So they do touch on those other issues that kind of are conflating issues to the COVID-19 pandemic. And so that's one thing that I just wanted to kind of focus on, is that, you know, when we're talking about these national issues, bringing them to a local focus can be really valuable for people to, number one, connect with the data, but also to connect with the issue and realize that it's part of their story. And I think a lot of times we feel really disconnected from news as individuals because we don't have that local perspective. And a lot of people, you know, there is a big, big hole that needs to be filled with this information. So I'm going to pull up some other resources kind of to talk about this. Pardon me, I'm sorry. Okay, so this is my document I created so you guys can see. And there's a link to Stat News at the top here. And so one of the things that you kind of have probably noticed about COVID-19 is there's a lot of information that comes out and we don't really know sometimes if it's true or accurate or comes from a good source. And so the very first thing I'm going to point to, is everything okay? Okay. I thought maybe you couldn't hear me. It's like, did my internet go out?
No, we can hear you.
Okay, good. Just making sure. So my internet has gone out several times on Zoom recently because like everyone is Zooming, you know. I have some links to different fact checkers here and specifically fact checks on COVID-19. This is a really great way if you're looking at information and data and you're not quite sure like what does that mean or how do I represent that? It's always good to kind of go look at other sources and see how they're representing it. And I suggest going to the fact check sources because then you don't have to worry about it necessarily being a partisan slant on the numbers. And they're pretty good at giving you a clear view at that. So there's factcheck.org, there's the COVID-19 fact checker, which is really interesting. I'll show you guys that one in a second. There's Politifact, which is a Gannett run publication. And actually I'm having a professor speak to a friend of mine who works for Politifact speak to my class next week, September the 9th. His name is Eric Litkey. If you guys want to join, I'd love to have you come join that talk. And then I've got, you know, the Pointer misinformation resources. So that's really useful. But I'm just going to start with this one right here. So you can kind of see what I'm talking about. And so this is the COVID-19 fact check. And this one uses information specifically from WHO and the CDC. And it was, and so a lot of the information here is in several different languages. So that's one of the reasons I like this is that it looks at information and translates it into all these different languages. So that's a really great place to start. And then this is the Politifact fact checker. And you know, a lot of these fact checking organizations are actually nonprofit. So the journalists do it, but don't get paid extra money to actually do it on top of the work they're already doing. So they ask you to maybe give a little bit of money. That's what that was at the top. But so here they have a scorecard about different coronavirus coverage. They've got fact checks on coronavirus here, and they're known for their little meter on Politifact that gives you the little, you know, how false is the information. So they have kind of an interesting way of displaying that information. And these quotes come from basically anybody who's said anything, right? So they will fact check politicians, they will fact check news organizations, they will fact check thought leaders, you know, the CDC itself. They will basically fact check anyone. So this is a really great place to start if you are like, oh, I heard that. I want to know if it's true and where can I find information? And it tells you what the source is. So here, a Facebook post, and then it tells you, you know, when it was posted, and then you can click on it and actually read the story they did about it. So another place is, you know, I'm not going to go through all these, but the Pointer resources are really great. And I'm actually going to show you guys a couple more Pointer resources too, so you can see those later. But this is the Pointer site, and it's all coronavirus information. So you can actually go look for a specific country. And this is collaboration between different news organizations all over the world. And so, you can actually look up the news organization. You can search. It's got a really great search function. And it will search the different information that was shared. So like here, this is a nurse was photographed in a deli wearing protective clothes meant only to be used while treating COVID-19 patients. And there was an article written about it in Brazil. And so this person, Angelica Lupa in Brazil, actually fact-checked this information. So you can go see that. So this is a really great tool that's been created, and it draws from several different places. So I just want to kind of point to those first, because actually a lot of local information ends up on the Pointer website as well. So I have all those listed if you want to go see those. Okay, so you know, nationally, we're going to really draw from main sources like the WHO internationally, and then the CDC numbers. Although we know that, you know, the information is being reported differently and the CDC has a little bit of a delay. The best place to get national information or national level information is still at the CDC website. So this is a link to the CDC reporting data, and this also includes information about any studies that have come out or projections for vaccines or any other things, but you can also find information about other health concerns there, right? So other vaccines or other health related stuff. The second link here is for the Pew Research Center. And so this is actually very interesting. This is data that they've collected from the United States of people who have certain thoughts about coronavirus. So what do people specifically think about different things about coronavirus? And so they have studies, they have some articles, you know, like they have some fact checks also. And these are all done at the US level, but they, you know, also sometimes include places like El Salvador or other places that might be valuable. And then they also have kind of a, you know, you can look for reports, fact checks, presentations, feature stories that they wrote that include data. And you can look at international, Middle East, you know, other resources. So this is a real, or even by topic. So this is a really good place to start when you're going to write a local story. You might actually go see if a national level story has been written on it, or if somebody's written about something in a different country that is similar to what you're thinking about writing. Yeah, and the Politifact class talk, like I said, is on September the 9th at 10 a.m. So I can send information to Dawn if anybody's interested in coming to that. Or you can send me an email at perreault@etsu.com or .edu, sorry. I get a little nervous sometimes when I'm navigating all this stuff here. So regionally, you know, we have two places that we can go look for stuff. And since we are in the Appalachian region here, I'm going to show you two different things that I kind of like to show to students and journalists. So this is the Appalachian Regional Commission site. And one of the cool things about this website is you can subscribe to a weekly email. And at the top of the weekly email right now is all of the local facts about coronavirus. So you can get that delivered to your...
Hey Mimi, I'm sorry to interrupt you, but I think we're not seeing the screen that you were seeing.
Oh, what are you seeing?
We're still seeing the tips and tools for reporting on COVID.
Oh, okay. Well, let's see. Stop share. Let's start again.
Sorry about that.
No, it's fine. I just opened it in the same window, so usually in mine it works. Can you see now?
Not yet.
No? Okay, let's see what's going on.
Yeah, it's not sharing at all.
Oh, you didn't see the other stuff either.
No, I don't think it ever went to that.
It wants to share a certain browser and not another browser. Okay, 1 second. I feel bad that nobody saw that. Anyway, those links to all the fact checking things are in the list. So I can go back and show those to you guys later. I'm going to share screen. This is what I want to share. Do you see the ARC website now?
Yes.
Okay, I don't know why I did that. So anyway, you can subscribe to the ARC website and get a local digest. And this will break it down by state. It also breaks it down by region. There's lots of different resources on here. You can search for, you know, research maps and data. And that's actually where I want to kind of take you guys and show you some of this information. And many of you might be familiar with this. So let's hope this works. Okay, can you see? Okay, we're still doing good. So this is all research reports. And so they have different reports basically that they put out on different topics. So there's one here on drinking water. There's one here on just general issues in Appalachia. There's one here on industrial makeup of the region. So there's tons of that. Then they also have little, so that's all research maps and data. You can click on maps here. And you can look at, let's just look at the economic status in Appalachia report, because we know economics are something we're really concerned about right now with COVID-19. And this gives us all the counties that are in Appalachia, and we can see their chance of being at risk for an economic downturn as of 2021. So it says from October the 1st through September the 30th, 2021, this is the data that we're looking at. And it is updated monthly. So they will update, you know, basically, you know, what the information they have is on unemployment and development and, you know, the GDP for certain areas. And then you can also export it in PDF. You can export it as a ping image if you want to embed it in something. And this is all free. You can use it. You just have to give credit to the ARC if you use it. And then here's some of the data reports. So you can actually select a state. So we'll go down here and select Tennessee. Maybe we want to know specifically about Washington County. And we can get a certain report here that gives us all of this data we can work with. Say we wanted to look at all topics that are in the list. And we want to look at the economic status report, education report, income, population, poverty rate, unemployment. So there's lots of different data there. And then, you know, economic status classification reports. So there's all of that data that you can look at on the ARC website. That said, there's also over here in the right-hand corner, all of these COVID-19 updates. So in the COVID-19 updates, you can basically subscribe to their weekly newsletter, which is called In the Region. And then you can also look at, they have national resources, and then they have specifically Appalachian resources for different areas about COVID. So that's super cool. And then they have a list of all the states that are involved in the Appalachian region. They have some webinars even that they've recorded and posted. So there's tons of information here about, you know, kind of the impacts of all that. And then they have this really cool interactive map, which I have a direct link to actually in my presentation, but it shows all of the COVID cases in the region, and it's interactive. So you can actually put your address in. So let's choose, I'll just choose East Maple Street, Johnson City. And I can actually zoom in and see how at risk I am for COVID-19 where I live, if that's where I live. Okay, so I'm gonna zoom out, and you can see this is yellow, and these are where the cases have been reported based on the numbers. And so the larger the circle, the more cases there are in that area. So you can actually see, like, I'm here, so this is probably Washington County, and this is probably, you know, here's Carter County over here. You know, you can also look at North Carolina counties, and you can see how many outbreaks there are in your region. So this is a really great tool just for visualizing all that information. Okay, I'm gonna go to my next thing, and hopefully you guys will be able to see that. And here's the actual article that explains the spread in the region. So you can actually see, you know, in real time. It was started in March to give us a better picture of that. And so you can kind of track it over time as well with this tool. Okay, the next thing I wanted to talk about was Google searches. So Google searches are really helpful because right now they have their own COVID-19 data kind of harvester. And so you can put in here, like I put Johnson City COVID as my search terms, and it gives me all sorts of different information. So it gives me the 3 top stories in the area. So I have one from WJHL, I've got 2 from the Johnson City Press that have numbers and can show me that data. And then this shows actually the daily change in cases in this area, specifically in Tennessee. And then I've got, you know, State of Franklin Health, Tri-Cities, you know, Weather Center's COVID tracker, and then stories about, you know, as of the 12th of August, I've got the top stories for what's been covered. Then if you go down here, there's more information from Tennessee.gov. So there's a whole bunch, it's kind of a digest. Similarly, they have that, they can show you where all the cases are here, right, with the map. And that information comes mainly, they said, from the New York Times, Wikipedia, and other sources. So you can actually click on that and find out where they exactly got their numbers for each state. It says the number of cases and deaths compared to the United States and then compared to the world. And then you can actually search and compare two different places if you're interested in that. So this is a really good search feature that Google has right now that will help you. And you can also get just basic things here. So if you just want health info, information on testing centers and where they're located, you know, how do you take care of yourself if you have whatever news that's been written, and then statistics for the area. Another thing that's really helpful is this health disparities report, which looks at different conditions in the area that already exist. So if you want to compare kind of the cases of COVID to other health issues in the region and get an idea of where that would be situated, this has information about the, you know, basically the health condition of the 25 million people in the Appalachian region. And so this is a really great report to look at too. And it's at healthinappalachia.org. So that's a really great place to kind of get more local data. Sorry. I'm going to add this one to here because I thought it was in here, but for some reason it's not. If you want to look at the health departments, I have all the health departments listed here, which a lot of this data comes from them, but this is the actual health department sites. Can you see my screen still, Dawn? Okay. And then if you want to look at specific trackers, so there is a news break tracker for Johnson City, which looks at coronavirus, but it also looks at other issues. So they have a crime tracker on there, you know, and they basically gather public information and then reshare it. This is our ETSU tracker. This is the one for Milligan College, and this is the one for Boone and Appalachian State University. So there's different places you could look at for those. And so I was going to show you guys a couple. We know what the ETSU dashboard looks like because we've all seen it. It pops up here. Might need to close a couple windows. So you guys have probably all seen this, and they actually just updated it, and it tells us, you know, what the case count is. We have 9 positive cases currently and 121 people that have had it recovered and 8 that are quarantined in housing. So you can see what's going on there. It gives you some additional resources to look at. One of the things that's important when universities put out information is you might actually want to go look at the local health department data, because there might be some discrepancies based off the time that that information was given. And as we know, because of health regulations, ETSU is not allowed to release information the same way that, you know, so if you're a student, you go to the ETSU Health Center, they're going to work really hard to protect your identity. And so that information might take a while to be reported to the local health department just because of that process. It doesn't mean it's not necessarily going to be reported. It just means that sometimes what the health department has might be a little bit lower than what, you know, what is actually true. So you should kind of think that there is a slight margin of error between different sources of information, and know that coming to the information. Especially because a lot of that is changing a lot, right? So a person could go in, test positive, and then 3 days later they're in recovery, depending upon what their experience is with the virus. Then the last thing I want to show you guys are some reporting resources. And so this is, you know, I showed you guys the Pointer site, which Pointer is a news training organization. They also do research on news coverage. And so we have the Knight Foundation has this really great coronavirus reporting kit, which was up earlier, and they have tons of different links to things that you can go find. So they've got, how do I cover the pandemic? So this is a web series that talks about it. Journalist tips for covering COVID-19. So these are all really great readings if you have questions about it. I've also got in here you know, a link here to different papers specifically that are in there. And then this is a really great resource for student journalists. So if you're a student and you're, you know, you're trying to figure out how do I cover stuff for my class, these are some resources from Teachapalooza. And they're specifically about like how to keep yourself safe and how do you not do face-to-face interviews in a way that might either compromise your safety or the safety of other people, and what are the safe practices. You know, so it's a little bit funny in a lot of ways, but this was shared with me by a colleague. And, you know, so thinking about being smart and using your resources and your technology well. You know, if you're going to interview people in person, making sure that those people are also outdoors, that you give yourself plenty of space between each other, that you understand what the rules are for the location you're in. So, you know, like if you're on campus at ETSU, people have to wear masks on campus. So don't be the journalist that shows up with your camera without a mask on, right? Because then you're breaking the law and you might be putting somebody else's life in danger. You know, thinking about, you know, still getting permissions from people to take their pictures. That's super important. And also, you know, how do I cover a protest, right? So, you know, understanding social distancing with that. So there's a bunch of resources in here in the document specifically about, oh, well, I'm a student, I have these questions, how should I approach that? So I know that was a whole lot of information, and I said it would take around 30 minutes to share it. So like I said, you're welcome to use this document and get more, you know, use whatever's in here to get those resources. But one of the things I think is super important to remember is that, you know, everybody has, oh, you said, okay, sorry, that was an old message. Sorry, Don. I just saw your message. One of the things that's really important is to think about, you know, this story that even though it's been going on for a while, for each community, it's going to look different, right? And depending upon how much access people have to healthcare. So one of the numbers that's on that Health Disparities ARC website is the number of hospital beds per people in communities. And that's important to know. And that's also available on the Department of Health website for each state. So you can go actually by county and find out how many hospital beds there are in case, you know, and ventilators there are and all that information. So, you know, like in Boone, North Carolina, which I currently live in Boone, it's an hour and a half from you guys, in Johnson City, there are only 3 ICU beds in the entire hospital here. So that's a really different picture than if you're in Johnson City where you have about 150 and have the capacity to get more. And so that's super important to know when you're covering stories and giving context. Somebody asked in the chat, where can you get the document I just shared? There's a link at the very top of the chat. I can reshare it. I'm guessing some people didn't see it because they weren't here yet. So here it is. And this is my email address. So if you have questions about it or you for some reason can't access the document, that's a really great thing. So I'm gonna take questions now, and I'd love to take questions from whoever wants to ask them.
Hi, Mimi. This is Shara.
Hi, Shara. How are you?
Good. I was just a couple minutes late, and I've been folding tiny clothes. I apologize. So I apologize for my disembodied name. But I really enjoyed your presentation. I learned so much. It was so interesting. I'd be interested if you would share any thoughts about how covering COVID, maybe especially local, is a unique challenge. Like what unique challenges you've observed in local coverage. Thanks.
Yeah, I think that's a really good question. So I have a really awesome student named Jonathan Roberts who works for the Johnson City Press. So most of my experience of covering COVID or what that's looked like has been from my interactions with him and his personal experience. So I'll just go ahead and give him credit. For that. Also my observations based off reading the newspaper and just kind of seeing what has happened. One of the major issues we have in this region is we live in a news desert. So we don't, and when I say news desert, I actually had a speaker in my class earlier today talk about this, but we actually do not cover local issues well in our region to begin with. And this is because a lot of the news media that we have are conglomerate media, which means they run national packages or national information and then throw in a couple of local things. Now, the Johnson City Press, even though I don't necessarily think it's the best newspaper in the world, does a really good job of localizing information, as does the Bristol paper. They, you know, they really do have a commitment to the local community, and they're doing that. WJHL does this to a certain extent, but one of the problems you have with broadcast is a lot of time broadcast, and I've talked about this before, broadcast reporters may not have lived in the area for very long. They may not understand it. And also the fact that it's a visual medium and this is a pandemic is a challenge, right? Because nobody wants to be caught on camera without their mask on. And then, you know, it turns into a major political issue, or they might just not feel safe coming out, right? So a lot of people want to do their interviews over Zoom or over phone. And, you know, and I think that's great, but it also can pose a lot of challenges, right? Because, you know, especially if you're going to be recording information, you need to get permission first. You need to, you know, make sure that everybody understands how the information is going to be used. And I think sometimes going into a situation, people are like, oh, I don't want you to record me on Zoom. What are you going to do with that, right? So, so I think that those are all challenges that we face in the pandemic. Some of them are a challenge because of location. Also, we're right next to the border, and so we're affected by 2 different states and their policies. And so sometimes what I feel like might be a useful perspective on, hey, this is how Tennessee is dealing with this. That's useful, but, you know, if Virginia across the border is, you know, where people are commuting into my state, is handling it a little bit differently, that also can influence the way the story looks, right? So the story is actually going to require me to talk to 3 different states, look at 3 different websites, and, you know, and synthesize that information, where it might just be easy to be like, oh, I just want to cover Johnson City, so I'm just going to call the Johnson City Health Department. Well, yeah, but, you know, that's not necessarily going to give you the full story, because of the location of the town. I also think that certain things like, you know, conflating issues like the fact that we're in a political climate that's really intense can be really intimidating for people. They might be neglectful to go on the record because they might not want to lose their job, or they might feel a chilling effect from, you know, or even be scared to say the wrong thing, you know, because people have lost their jobs recently in this climate. So I think that makes sourcing information even more challenging. And also the fact that we don't know a whole lot of things about this virus still. And so we have to trust information and sources that sometimes might turn out to be wrong. So that's a hard thing. Yeah. Okay. Does that answer your question, Shara? Yeah. Okay.
Yeah, thanks. Great.
Caleb says, Caleb asked a question in the chat. I'm going to try to answer it really quick. He said, that, what are my thoughts about COVID-19 being a political hoax? Well, it definitely isn't a political hoax. You know, we've been covering this a lot, and the question as to whether or not a motorcycle accident was listed as COVID-19, I think that that's a really interesting question. I think that, you know, a lot of times people might have this disease that don't realize they have it, and they might be asymptomatic carriers. So we can't necessarily rule that out, even if they were in a motorcycle accident. But that said, I'm not a coroner, and I did not do the autopsy. So my suggestion as a person reporting that would be to go to the death certificate office and have a conversation about what was listed there, and also talk to the family members of the people. And if that turns out to be their concern, as a reporter, you shouldn't be making the judgment on that. You should be sourcing people that say, hey, I think this is not the way it is because here is my information and here are my facts. Or, you know, versus, you know, and that's why it's important not to just talk to two people. You know, shouldn't be a this versus that story. It should be a, well, this is what this family's experience was. This is what tragically happened to the people in that family. And this is the climate we're in and the challenges we have. So I think that, you know, we still don't know a lot about testing. There are still a lot of challenges to that process. However, there is a pandemic going on and thousands of people have died, and this has happened all over the world. So it's not a hoax at all. It's definitely true. Trish has a question.
I just wanted to say, I feel like social media, Facebook in specific, has a lot of influence on what people believe, what people think. And personally, I believe that sometimes facts get mixed up with how people feel about something. Mm-hmm. The most recent thing being, there's a lot of buzz around social media saying the CDC is now saying only 94% of, 94% of the cases that have died from COVID-19, they died from something else with it. But isn't it true that the CDC has been saying all along that people with comorbidities are more likely to be the most ill or the ones that have fatality from it?
Yeah, and I think that is the case. I mean, most of the fact checks have said that. They've said, hey, this is still true that people who are at high risk already with comorbidities, or what you said, or have pre-existing diseases or things that would make them immune compromised and more susceptible, are more likely to die from COVID-19 because it is a disease that takes a previously weakened immune system and makes your condition much worse. And I totally see that, Trish. I think that most of the information out there has confirmed that. What makes this a challenge in our region, so when we're talking about our region, is that people in our region have an increasing number of pre-existing conditions that make them at risk for COVID-19. So, diabetes, heart conditions, pre-existing respiratory issues, being obese or overweight to a certain degree because of those health conditions, having a high infant mortality rate in the Appalachian region, really bad maternal care, really bad care for minority populations, a pre-existing poverty rate. Those are all things that put you at higher risk for any disease. And in this case, COVID-19. So I think, that kind of speaks to what Shara said before. That said, I personally have known people who have died from this, and they were pretty healthy people. So you can't really generalize anything, which I think is what makes it so hard to cover, because we want to be able to say, well, if you have this and this and this and this and this, then you're going to get it, right? What we do know is what we can do to prevent it. And so that's why, cities and states and the health departments and health organizations and researchers and scientists have said consistently, hey, yeah, we can reduce transfer by wearing masks. If we physically distance ourselves from people, we will be safer. And I think that, whereas there are a lot of things we don't know, we have to go with what we do know to be true in this case, right? As a journalist covering it, your responsibility is to report the information you know and make sure that you say where it comes from. So if I want to cite somebody, and that's really what they do on social media. You can see in that Politifact thing I pulled up, it said there's a post on social media that says this on Facebook. How true is that? And you know what my friend Eric does, who works for Gannett, is he will go look for one of those, and then he'll be like, okay, well, it's saying this. Where did that information come from? And then he will call those people and say, did you say this? And why did you say it? And where did you get your information? So, I mean, I think it's kind of like reverse reporting when you're doing that fact checking stuff. That said, everything gets politicized right now because we're in an election year. So, you know, just because a politician says it, and you think, hey, this is my party, I align with these people. I don't even think that if you're, you know, you identify as a certain political party, you should take what they say as fact. You should go look at the source of the information and verify it. Because, I mean, that's what you need to do, which is one of the reasons I gave you all of these resources to look at. So, you know, I think where we get in trouble is we say, oh, well, so-and-so said it, I trust that person, that's the way it is. You know, if we all did that, you know, we might all end up dead. I don't know. You know, it's kind of like saying, oh, you'll be fine just not wearing your seatbelt 2 blocks if you drive that way, right? And then you get in a car accident because most car accidents occur within 2 blocks of your house. I mean, I think that's kind of the point. But I think it's a good point you make, Trish, that, you know, yes, that's definitely been consistent. Most of the research has confirmed that from scientists. I am a scientist of a sort because I went to PhD school, but I am not a biological scientist, and I trust their research because they know the process. But that said, most scientists have to present their research in a way that's explains what they did and how they came to those, you know, those conclusions. I think most people just aren't willing to read that information, and they trust other people that say things without reading it for themselves. We have a very high expectation, high responsibility as journalists and communicators to go verify that information and figure out where it came from.
I wanted to ask you a question. This is a little more general, but you know, you have lots of experience with research with crisis response reporting. What, if anything, comes close to being comparable to what you've seen with COVID-19?
I don't know. It's like, it's an elongated crisis, and we've also got all these new crises that are kind of wrapped into it also. So that makes it really challenging. I actually think we're at like a kind of what they call a paradigm shift in the way that we think about crisis communication right now. The last one happened at 9/11. So, you know, like I can't say this is like 9/11 at all. But in a lot of ways, it's very similar to smaller, you know, smaller epidemics and pandemics that we've had in the past. So, you know, I have a friend who works at Middle Tennessee. Her name is Katie Foss, and she's done a lot of research on the coverage of the, you know, the 1918 flu pandemic, and has found a lot of similarities to what's going on with this and that. The problem is that people actually read the news back then and trusted the newspaper. So, you know, their experience was they didn't have Fox News or CNN or MSNBC duking it out every day, you know? So they had, you know, primarily one source of information telling them, you know, reporting the health information data, and they couldn't go on the website and look for it themselves. So, I mean, that whole media environment we are in truly complicates this. To the degree that people are like, oh, well, you can say these numbers are this, but you can also say they're this, because, I mean, we're not all statisticians. And so I think it's very similar to that in actuality, but actually the way that we're seeing it play out in the news media is very different because of the media environment we're in. And this media environment, by the way, existed before COVID-19. So, you know, we kind of just threw a pandemic into something that was already very divisive and segmented and niche, and it created the perfect storm. I feel like I'm in a hurricane every day, though. I mean, honestly, the news I see, it's like, well, you know, I think if we treated this like a hurricane, it might actually be a little bit better, because like, hey, it's coming, it's here, it's destructive, it destroyed our homes. We're going to have to deal with it. We're going to have to deal with what's here. And we're going to have to figure out how to manage it, right? Because when Hurricane Katrina happened, it took years to rebuild New Orleans. And that's where we are. It's going to take us years to get back to where we were before this, and mitigate all of the conflating challenges that it's taken for us. And I think that just makes it so much more challenging, you know? But at the international level, I don't think any of us have seen anything like this before. I mean, it's much more like World War II than it is like actual epidemic, the way it's affecting our world. Oh, Shara has another question. Anybody else have another question?
Yeah, I'll let somebody else.
Maggie or anybody else? Oh, I have a question here. Okay. Caleb's just clarifying what he said. Yeah, and I think your argument about it being a fishy situation is a very good point, because you know, honestly, we should be skeptical of the information we receive, and we should be looking for sources to verify information. But I will just say, I have never seen something affect a population the way this has. And yeah, you know, Twitter, the whole thing with Twitter, I'm not talking about social media. Twitter is not the American press. It is a private company. It can do what it chooses to do. And so, I mean, that's a whole nother conversation about, you know, how they fact check their information. What I would do is I would go to these fact checking news organizations, and those are going to be the ones that give you a better idea. And actually, there were 3 articles about what you just said here on Politifact today. I actually posted one on Facebook. There was one in Forbes about it too. So, you know, other publications are doing these stories, and Forbes is a pretty standard magazine business publication. It does some great work. So I would go check out what, yeah, smart, qualified, and intelligent people. And I would just say I have limits as to my smarts, qualification, and intelligence. I am not a professional fact checker. I study crisis communication and the process that journalists interact with information. So, you know, as a journalist, what I said before would hold. Other questions, Heather, Becky, anybody else? Shara, you want to ask your question?
Sure, we get time. Okay.
Oh yeah, sorry, I have one. I have type 1. Okay, Maggie. Okay, and she says it's hard because each news website has a different answer. I wouldn't trust any of the news organizations. I would look at who they're citing, and I would go look at that information first. So, you know, especially as a journalist, personally, yes, you have to have a trusted source, but you should be reading, if you're a news consumer, at least 3 different sources of information to get your information. You shouldn't just be listening to Fox News all the time, or NPR, or reading the local paper. Like I suggest to people, they look at 2 local news sources, 2 national news sources, and then something that has at least 1 international component to it. And that's just a media literacy recommendation. That's not, you know, and as a journalist, you should also be reading information, because how are you supposed to know how to cover something if you've actually never read a news article before, right? That's super important. You have to be able to read before you can write. So Shara.
Oh, I have one.
Oh.
Hold on, let me turn my camera on.
Oh, hi, Becky.
Hi, sorry, I was cooking dinner and I didn't want you to watch me rushing around. Well, it's more of like what are your opinions on this? Because I feel like in COVID, a lot of the issue that we're seeing with people not believing the news and what they're being told is safe, are a lot of organizations jumping the gun, covering information that hasn't been solidified or confirmed, and then that information at the end of the day ends up doubling back on itself. So a lot of people just say, well, why would I believe anything I hear anyway? Like, masks obviously don't work, because at one point they said they don't work. So yeah, do you have any thoughts?
Well, I
about
think there's a fallacy in assuming that in a crisis we can know every second of the day what is going to be accurate, right? And so that's why it's important to say, well, at the time of this report, as a journalist, this is the information that we had. This is what was shared with us. And, you know, if something gets wrong, you got to go back and correct it. You can't just let it stand. So, you know, if for some reason somebody said, hey, masks are bad and you shouldn't wear masks, as a news organization, you have to come back and be like, well, you know how we said that? We're wrong,
Being willing to take accountability.
Yeah, and be willing to take that. And honestly, that's just a hazard of reporting a crisis, because, like the facts that you have at the beginning are not necessarily going to be the facts, especially when something goes on as long as this has, right? The situation we were in March, in a lot of ways, is very similar to what we're in right now, but we also know a lot more about this disease, and we know, what happens when you get it and what happens when somebody dies or, has long-term health effects. Because, I mean, we're seeing that, a lot of people are like, oh, so many people are going to die. Well, yes, so many people are dying and it's tragic, but all the people who still are recovering from it or have long-term health effects, that is the big concern, right? And we still don't know what those are, because it's only been 6 months, not even 6 months, right? We don't know what that's going to mean for, a 5-year-old who gets it, or, a 42-year-old who might develop heart disease later. Like, is that going to conflate their problems or not? And so I think sometimes when you're sharing information, what is the ethical thing? It's to say, well, at the time that this report was done, these are the facts we had, and this is the information that we shared. And then coming back later and saying, oh, by the way, we got it wrong and new information is out there, right?
Yeah.
And so I think that's the problem. People want to be like one and done. They're like, oh, well, I read an article. Well, news was never meant to be just one article. It was meant to be like, okay, we're consistently covering these public meetings. One article on something doesn't make you necessarily an expert when you're a journalist. It's writing multiple articles and having multiple sources and having to gain knowledge of that makes you become an expert, right? And journalists are, for the most part, not experts. Many of them are covering lots of different things. Many of them are gathering the information that they can get quickly, right? And report on quickly and verify quickly. And so, that puts them at a disadvantage in a pandemic, because, there may not be any new information. That's pretty hard if, like, your main news value is like, hey, it's new, like, it's the news, it's new, and so, thinking about reporting in a way that reiterates those things we already know to be true, but also integrates new information is very valuable. Any other questions? I know we're almost out of time.
Shara, did you want to ask yours?
I was just talk to me about it later. I think I've got too much chaos here right at the moment. But thank you so much. It was so great.
We're all with you. Thank you.
All right. Any final questions?
I would love to answer questions also over email. If anyone has additional questions, feel free to email me. Like I said, I can't disprove the conspiracy theories except for with facts. So, and I don't understand why people pass them around, because they can be really destructive. I think we should just practice kindness and generosity. And like I said, admit when you make a mistake. That's a good policy. Super, super important.
Okay. Well, thank you very much, Dr. Perreault.
Oh.
And I'll just give a quick announcement. Now, next week, Media Monday will be off since it's the Labor Day holiday. But keep in mind, classes are held at ETSU next Monday. So if you have class on Monday, you do meet that Monday. But we'll return to Media Monday on September 14th at the same time, the same Zoom link. And we're going to welcome Thomas Witt Ellis. He's the program coordinator of Africana Studies at Fresno State in Fresno, California. And extremely timely, he's going to speak about social justice through the lens and on the stage. And Mr. Ellis, he's also an actor and a producer, and he's an expert in African-American film and stage productions. And so I invite you to join us then, if you are able. And then pretty much every Monday night at 7 for the most of the rest of the semester up until Thanksgiving, we'll have Media Mondays. But again, I want to say a final thank you to Dr. Perreault. Thanks for sharing all that fantastic information.
Thanks. And it was a pleasure to be here today. So thank you so much for having me. And I look forward to another Media Monday at some point in the future.
And if any of you need to see the recording or want to share it with somebody, as soon as it's available, I'll have it posted on the Student Media Facebook page, or just send me an email if you need it as well. Other than that, it's 8 o'clock. So I'll give it my usual, I'm going to shut up, and I'll see everybody virtually later.